Chairman, I want to thank all the witnesses for being here. This is something I think we can all agree on. This is inefficiency, where the Americans struggling day to day to be able to pay for their fixed costs, so they've got a little extra money to take their kids on a vacation or just spend some time to go out to eat. PBMs just suck money out of average Americans' workers' pockets. There was a point to them at one point in terms of improving efficiency, but in the most costly healthcare system in the world for a developed country, 18% of GDP, with the worst outcomes, this is a perfect example, Mr. Chairman, of something you and I have talked about often, that Democrats and Republicans should be able to come together on. It's wasteful. Well, let's be efficient and let's save Americans a little extra money so that they can get out of the stress they feel where they've got to worry about gas prices and just paying for lunch for their kids. Here's a perfect example of something that does no good for really anyone to speak of other than the people who make money off of it. So here's a real opportunity for employers and for working people to get a real benefit. PBMs are, as I just said, a huge part of the problem and our inefficiencies. Americans should be embarrassed by this and outraged. Unfortunately, their business practices are notoriously opaque, leaving employers and workers the inability to even get an idea of what they cost. I'm proud to say that we have done good bipartisan work on this committee and this subcommittee to get a real start on PBMs and improving transparency and efficiency. My colleague, the gentleman from Connecticut, Mr. Courtney, introduced the bipartisan Hidden Fee Disclosure Act to shed light on fees charged by PBMs and third-party administrators and other service providers. We have also worked in a bipartisan manner to craft legislation requiring detailed disclosures of PBM rebates, fees, and other information to group health plans. I am pleased to see that portions of both bills were included in February's spending legislation. I hope that these reforms, as well as the important rule proposed in January by the Department of Labor, can lead to progress that reduces conflicts of interest and inefficiencies in the PBM model. We can't wait. There's real urgency, in my perspective, to fixing this and get rid of the fraud in the PBM model. But demanding transparency from PBMs alone will not solve the crisis of skyrocketing drug prices. We cannot get a handle on this issue until we address the elephant in the room, Big Pharma. In 2022, Democrats, over, unfortunately, unanimous opposition from our colleagues, and we'll hope to change that, took a historic step forward by creating the Medicare Drug Price Negotiations Program. In just the first 2 years of that program, lower prices have already been negotiated for 25 drugs that account for more than $90 billion in spending. It is now time for Congress, in a bipartisan way, in my view, and I'll work every day to work with you, Mr. Chairman, in a bipartisan way to lower cost for Americans with PBMs and negotiate competitive prices for the market to work the way other developed countries have. The EU, Australia, New Zealand. I've talked about my own personal experience with the drug that keeps me alive as a survivor of stage 4 leukemia. Much of the investment in that drug came from taxpayers at the Department of Defense over the last 60 years and in NIH. Really remarkable. I'm alive today because of this research, but Johnson & Johnson, and haven't spoken directly with the CEO of Johnson & Johnson over that, the Oversight Committee, and we brought him to testify. It's fair to get a reasonable rate of return. We encourage that for the private sector. But let's be honest about where much of the primary investment in research came from, American taxpayers and the brilliant people in the Department of Defense and the NIH and DARPA and ARPA. The legislation we've introduced on PBMs goes to the root of the problem, both for PBMs and the other issue about Big Pharma. In this instance, with PBMs in this hearing, targeting middlemen who offer little value to employers or to workers. Thank you, Mr. Chairman. I yield back.